Hi everyone, I'm Daniel Williams, Senior Editor at MGMA. We're back for another MGMA Podcast live from Orlando for our 2025 Leaders Conference. And I have a special guest that I am so excited that we have on the show today, Maryann Kawaksheh, who came all the way from Qatar to enjoy the show.
Yes.
So Maryann, welcome.
Thank you, Daniel.
Yeah, I was talking to our mutual friend Linda Carroll previously at the show. I was thinking that Linda, who came all the way from Alaska, might have traveled the farthest distance.
I beat everyone with that.
I think you set the record with that.
I
So
do.
tell us about that. All the way from Qatar, how did you even know about MGMA? And bring us up to speed in that regard.
MGMA. So I used to work in Alabama prior to Qatar.
Okay.
And when we went to Qatar, I went to Qatar to build. We have a hospital that we started from scratch. So it's a greenfield hospital. It was a great opportunity to go and be involved in that. I've been there for a year. I went with the intention of staying for a year. I've been there. This is my 8th year.
Okay.
So I have no intentions of leaving until they tell me to leave.
Okay.
So the hospital is doing great. We came to a point where we started looking for benchmarks because we're expanding our compensation scheme and we wanted to see how the best benchmarks. We needed benchmarks is basically what we needed. So I remembered we had MGMA we used it back in the States. So I just tried to advocate to get it. It's very expensive because we have to get an organizational membership because I was the only one that was going to be using it.
Okay.
But it was I think we're one of the 2 international hospitals. I'm not sure.
Okay.
There's somebody else. There's one other country that has MGMA as well.
Okay.
So I kept on pushing for it and we finally got the organizational membership. I think this is the 2nd or the 3rd year. So yeah, we've been using it. We've been using it. It's very interesting.
I have so many questions I want to ask you about. First, you had me at Alabama because now I'm singing. I'm going from Alabama to Qatar. I'm thinking, because I came from Alabama with a banjo on my knee and I went out and moved out to California.
Oh, okay.
That was culture shock. But Alabama to Qatar, similarities?
Prior to that culture shock, I had a previous culture shock. I'm originally from New York. So I went from New
York to Alabama.
New York to Alabama. I needed a translator from English to English when I got there.
You did.
And after that, it was Alabama to Qatar.
Okay. I have to ask because I lived in Alabama for 15 years. I was in Birmingham. Where were you?
I lived in Hoover. I worked at Children's of Alabama.
That's amazing. What a small world. We went all the way to Qatar to connect here in our Alabama connection.
So the reason I come here is because of exactly what you said. You spoke to Linda, who met me. It's the networking. It's an amazing opportunity. So Linda's a pleasure as well. I can call her out on here.
I know.
So she said, you have to meet with Daniel. And I said, who's Daniel? And I said, okay. So yeah,
well, I just bumped into her at the breakfast. You're going to leave for our breakfast right after this interview. And she told me you found the Qatar job on LinkedIn, or they headhunted you or something. Tell us about that story because that sounded interesting.
There's a lot of things in the background that led me to search for a job, and when I went on, it was just Indeed, the normal, the websites that have the positions, and I just put out an application, and then I completely changed my mind about it, and then somebody called me and they said, let's do an interview. We really want to talk to you. And I said, I don't think so. And then they called again. And not the second time I said, okay, let me do an interview.
Okay.
And I did. And I said, I'll take a chance. We'll go for a year. And there we are.
That is so incredible. Well, here's an immediate question because I don't know global health insurance or anything. I mean, what translates? Because you're coming from Qatar, a practice in Qatar. You're here in the U.S., in Orlando at an MGMA event.
Yeah.
Where do the healthcare principles and processes, have a connection where you can get something out of this show?
It's very interesting. One of the sessions I attended yesterday, they were talking about expanding their ambulatory care, which is exactly what I'm working on right now.
Okay.
It's exactly the same. The healthcare there and here is exactly the same. We have national health insurance and we also have the private health insurance. And the ambulatory care is the same issue, getting people in, the long wait times, the space constrictions, it's the same story. So it's very interesting to hear a different perspective on what they're doing and how it can relate to what I'm doing. So I think that's what I benefit out of these conferences, is that I heard what they did. I said, okay, I did that as well. But then I asked a few more questions what are they, what type of benchmarking they're using and things like that. And it's the same story in a different location.
Right.
It just translates just like that, yeah.
Well, tell us, is there something strikingly different from one country to the next in healthcare, the way it's presented, the way patients are met?
Strikingly different. So they have a national health, so it's a government subsidized program.
Okay.
So I work at a tertiary hospital for women and children.
Okay.
So we have, in our hospital I'll take pediatrics as an example, we have the sole service providers. So we have the specialists that are not available anywhere else. So children come to us and they come and they pay just a copay, 30, 50 reals, which is equivalent of $10 or something like that. It's a small amount of money. It's just like government, like Medicaid, similar to that. They pay the amount and they see the specialist that we have. If they decided to go elsewhere, they would have to use their private insurance. So the companies also provide us private insurance. But we are the sole service for the country of all the pediatrics. So we have specialists that come from all around the world. We have world-renowned physicians. We have, like our pediatric urologists, they created they created opportunities for children that didn't exist. We did separated congenital twins. They have a lot of specialty surgeries that are taking place in Qatar. I know a lot of people don't think about it, but they're really innovative, very innovative, yeah.
That is so cool.
Yeah.
So we're on the last day here at the Leaders Conference.
Yes.
What's a thing or two that stood out to you? I know that networking, those connections. What else? What's been going on that really resonated with you?
So the one thing I'm looking at, I really enjoy looking at the AI right now.
Okay.
So everybody's talking about AI.
Yeah, they are.
There's at least probably 5 of the sessions I attended had to do with AI, how to leverage AI for what you're doing, but they also focused on the human part of it.
Okay.
So AI is intended to do things that are mundane tasks, things like that.
Right.
But what they focused on at this conference is that you have to free yourself up to do the human things, connecting with your team, being able to do the things that you don't have time to do when you're doing your job. And I think that was a really interesting perspective on it. Yeah,
I love that.
Yeah.
One more question then. Detail for us, because I'm just trying to imagine. I just flew to Spain earlier this summer, and that was somewhat of an ordeal, but what was the logistics like to travel from Qatar to Orlando? Where did you start? And I know where you wound up. You wound up here in Orlando.
So from Qatar, I had a direct flight to Miami. That was about 15
hours.
15 hours, and then a 40-minute from Miami to
Yeah,
here.
that was nothing.
Yeah.
So 15 hours. What's your go-to when you're on a plane for 15 hours? Do you read a book? Do you watch a movie? What are you doing on a plane for 15 hours?
I took the flight that was at 1 a.m. So my go-to is 8 hours of sleep. So it was nice. I had a good flight.
Did you wake up and it was yesterday or the day? Well, how does that go logistically?
I woke up and it was, you know what? I don't know.
You lived Sunday twice. You had the same day twice.
So when you're coming to the States, you gain some time, and when you leave, you lose some time. Yeah.
When are you heading back to Qatar?
I will be taking a few more days. I'm heading to New York.
Okay.
And then I'll be heading to Qatar.
Is that where you grew up in New York?
I did, yeah.
Okay.
Yeah.
Fantastic.
Yeah.
What else? I'd said that was the last question, but anything else you want to share with us? Anybody who might be listening? Like, hey, if I came all the way from Qatar, you can come
It's definitely worth it.
Yeah.
It's worth the networking, as I said. You learn a lot of things, even though you think you know everything.
Right.
But honestly, leaders need training. They need continuous updates and things like that we lack. And understand it helps you to understand your leadership style, so you can go back and lead your team appropriately.
All right.
Well,
Maryann, thank you for coming all the way from
My
Qatar.
pleasure.
This is just amazing.
My
Just
pleasure.
glad to have you
One
here.
thing, interestingly enough, I know you have to go, but all the vendors that I've spoken to, and when they ask me, where are you from? And I say Qatar, where? So I think we have to educate people where Qatar is. Nobody knows where it is.
Hosted the World Cup. You think that kind of put it on the map for me. And then there was the debate, is it Qatar, is it Qatar? But
either way, everybody says it differently.
They do? So interesting.
Yeah.
Okay. Well, it's great having you here.
Pleasure. It was nice meeting you.
You too. Well, everyone, this is Daniel Williams, Senior Editor at MGMA, meeting with Maryann all the way from Qatar. So Thank you so much for being MGMA Podcast listeners.